Hello, and welcome to this week's episode of Ladies, Let's Talk About It. I'm your host, Dr. Denise Jagru. I'm a board-certified clinical specialist in women's health physical therapy. Today, we're talking about women's health in the workplace. Normally, we think about women's health as a personal issue, right? But women's health absolutely affects everything around us and everyone around us, especially in the workplace. It's a reality that women have a biological reality, right? We have fluctuations in hormones, we have menstrual cycles, and we go through different stages of womanhood that require lots of these different fluctuations. It can affect productivity, mental focus, participation in work. It can also affect career expectations and progression. And men do not have to worry about any of this, right? So here to talk to me about this today is two of my very good friends that I have known for a very long time. And I was trying to figure out how long. I feel it's been like 10 years that I've known both of you.
At least 10
Yeah.
years, yeah.
Yeah.
Mhm. And we all worked together at one point in the same hospital system. And we met each other there. And we've been in each other's lives in different capacities, going through our life journey together. And I'm so proud and so happy that you both are here to discuss this with me. Thank you for being part of this and coming here.
Thank you for having us.
Thank you.
And this is my first panel discussion, so I'm very excited. So I have two guests on that couch. And I'm so excited to have like a group discussion about something. I've always had just one guest, so this is going to be very exciting. So they're both occupational therapists, and I'm going to first let you each introduce yourselves. And then one of you, I'd like to have just explain what an occupational therapist is.
So I'm Victoria Herrera, an occupational therapist. Been doing this more than 10 years now. It's so crazy. But yeah, it's rewarding, but also stressful at times. So I'm sure everyone might agree.
Yeah. I'm Corrine. I'm also an occupational therapist. I'm also a certified hand therapist. So my specialty is the upper quarter rehabilitation. And you wanted us to define like what it is.
a
What is
PT?
occupational
What is an
therapy?
OT? Because I'm a physical therapist. They're occupational therapists. We work together. We do different. Sometimes what we do overlaps, but they do specifically certain things. We do specifically certain things. So if you can just kind of describe the OT side of it.
Definitely. So it's a question that I think that we get almost every time that I introduce myself at the bedside in the hospital. What is OT? I don't need a job. So we define occupation. I retired 10 years ago. So occupational therapy, actually, we define occupations not as only your career, but everything that's valuable and important to you so that you value to do. So based upon that, a lot of times we end up meeting you at a point of like illness or injury, like status post. So as a certified hand therapist, usually like some sort of upper quarter injury, fracture, something like that. And we help you get back to doing what you need to do, either through like adapting what you need to do, adapting the workplace, adapting your home, or through rehabilitating, like whatever it is, be that a physical, cognitive, psychosocial element that's stopping you from doing what you need to do or that you want to do, like what's important to you.
And we're often on a team, like OTs and PTs, and we work together to help the patients rehab. So we always are in partnership together and working together and collaborating. So thank you for sharing that. And what I wanted to talk about today is, women's health and how it affects the workplace. So one thing that we can all say we all experience is menstrual cycles. And sometimes they can just be debilitating, right? And even if they're not debilitating, the amount of changes we go through in just those first days of having your period, being extremely tired, increase in progesterone decreases your wakefulness. Having sometimes debilitating pain, sometimes bleeding very heavy, which can, we're therapists. So like we are patient facing. So we have to be like chipper all the time. And, you can't let this show, right? And like you're trying to focus on rehabbing someone else's pain or, painful journey or something like that. And you don't want to bring your own pain into this, right? But did you know that in Spain, they have menstrual leave, right? And just very
found it out.
recently, right? Like they can take, I don't know how many people take them up on it, but like you can take 3 days, up to 3 days a month, which I would do every month for, if you have a doctor's note for like menstrual leave, if you're just out of it or if you're in a lot of pain. And I think Japan and Indonesia have similar policies. And we do not have this.
No.
In our country at all. Would either of you take It would, like, if you had to take like if you had the opportunity to take a menstrual leave, would you take it?
Absolutely. I think, I mean, menstrual pain affects everybody differently. So not, it's not like a blanket symptom at all. But I've been fortunate that while I have had moments where it's been awful, I know people, it's just debilitating. They can't get out of bed. They can't walk. It's just migraines, discomfort, the bloating. And yeah, it's anything that it would put anybody in a hospital sometimes.
Yeah.
And oftentimes I think we're expected to just work and power through it because the work infrastructure isn't built to acknowledge that, as
Right.
part of, as part of overall healthcare and well-being. So absolutely, I think it's something that that I would take if it was
Yeah.
offered for me. And I think that it would help honestly, with my productivity.
Right. And that's the thing,
So,
if you're speaking about like workplace structure, like technically the worst workplace is not meant, wasn't made
mhm,
for women, right? It
Mhm.
wasn't made with
right.
women in mind,
Mhm.
right? Because it was supposed to be like men in the workforce. And then Henry Ford back in the day created the 8-hour, 5-day work week to actually try to like manage what was actually happening, which was like really long hours and like children working and blah, blah, blah. So, but this was during like, this is Henry Ford. This is like industrial revolution and car development and car factories and stuff. And it was about men working. And they didn't think about like women coming back to work after having a baby and you're still bleeding, and you're still like going through this like hormonal storm and you're not okay. And then, okay, just go back to what you're doing as if like nothing happened, or like men aren't thinking of let's create a policy for women who are having terrible periods, right? To like have some time off because when you're in terrible pain and like you're not focusing, like you're not productive. And if I have the opportunity to take days off, I would make sure that I'm like, when I'm there, right? And like when I'm not functioning, I'm home and resting.
Mhm.
But like, instead of just being physically in a place because I'm expected to be there, I'm supposed to be there, I'm not given any allowance to not be there.
Mhm.
And then like I'm not productive and you're just trying to like pass the day. Like, what's the point of
Mhm.
that, right?
Right. You're just physically present, but you're not,
Mm-hmm.
you're not all there. And so it does affect the quality of your work as well if you're
Right.
trying to power through
Right.
discomfort.
And then there's
Productivity loss is already there because most women are doing this anyway.
Mhm.
Like if it's during menstrual cycles or during like perimenopause or menopause, like later in the career, like at some point, I feel like most women can relate to, I'm just a body in this seat right now,
Mhm.
showing up through my pain because I was taught to like push through and I have no other real out or option. So I think that the productivity and the monetary loss is like already happening. Like
Mhm.
just give, the leave so that
Like, give us the days,
the
man.
leave.
Give us the days.
it's already not good. Yeah, it's already lost. Yeah.
I mean, imagine if like women were the architects of like, the workspace and like the traditional like work schedule. Like we would manage it so differently, right? We would have designed it so differently. And I mean, other countries do it differently. Like in Canada, I feel like you can take a year off, I believe, like after having a child. I think in Norway it's like 2 years, like you have and that's what it should be. Like it's after a year,
And
like
with
maybe
pay.
you kind of
Yeah.
feel like yourself, like it takes a long time to adjust. And to be back as if nothing happened a few weeks later is just so unreasonable. And I think a lot of women can resonate, and relate to this because it's just not designed for us,
Mhm.
and not for like all these stages of womanhood. They didn't accommodate for any of that,
Right.
Yeah. It's such nonsense. And what about like workplace stress and burnout, right? Like I feel like that is not accounted for at all. Obviously, I feel like in this country we're expected to work with like very little vacation time. It's almost kind of looked down upon to like take vacation. And I think we should all have mental health days, not just menstrual leave days, but mental health days, and I think that, it's kind of expected that like you work and not like take off. In France, I love France. France has so many great things. They have like 2 months off in the summer that you're expected to take. They also have at least 12 or 8 to 12 sessions that are after you have a baby that it's included in your insurance plan for postpartum care with a pelvic floor physical therapist. So it's just included because they're considering that quality of life issue, rehabbing. Like it's brilliant, right? And we just like, I feel like the culture here is like work, and like not taking the time off to heal, just like repair,
It's that we live to work
Yeah.
type of culture over
It's
here.
not very
Yeah.
balanced.
No, not at all.
Yeah, not
Mhm.
balanced.
Mhm.
Um,
And all of these like hormonal changes on, and like life changes, it affects like sleep, like sleep cycles and like, if you're stressed all the time too, like you have higher cortisol levels and all of this can affect. And I feel like there's just not enough emphasis placed on just like more mental health and more like repairing, and resting.
and I
Mhm.
think for women too, like I think it's been shown that we have higher rates of burnout, especially in healthcare, because we're kind of like praised for our empathy, right? But that empathy like also has such a downside for us as people, because while it could lead to like greater outcomes medically and for our patients, and we're like always praised for it, but then if we're spending more time with the patients, then we have to take our notes home. So like it increases like our
Mhm.
personal, emotional burden that we're like going home with.
Mm-hmm.
And then on top of that, a lot of women are doing like, a lot more emotional work in the home, caregiving for children, for family members, kin keeping, and those
Mm-hmm.
types of things tend to, so it's extra, extra burnout on top of just what we're experiencing at work and especially in healthcare.
Yeah, absolutely. I just
Yeah.
feel like that is what is expected of us. Like, I feel like that, I mean, I'm not speaking for all men, but I feel like it's just not the responsibility that is expected of men to like take care of the house and take care of the children and have a successful career and like do all of this and still have a smile on your face,
Right.
Like, I feel like there's just so much like pressure put on women to, like you said, if we're not taking care of children, maybe we're taking care of parents, and a lot of us are in that in between like that age where like you could be taking care of both or you're taking care of one or the other, and it's a lot, right? It's a lot on your stress levels, on your heart, and on your mind, and then you have to still just perform at work.
Yeah.
And it's like we need two incomes these days, like so many households, it's so the norm. So I'm hoping that men, and I have like a lot of younger brothers, and I do see that they're becoming like more aware of like, okay, like I should, and I'm gonna have to because now like I need the women to work as well, like pick up some of those things. But that's where I think like a lot of these policies, if they could be like just flexibility in
Yeah.
general or like kindness could help like everybody in the
Mhm.
workplace, not just women, just helping like men too, and hopefully encouraging them to
It
take
would help the whole household.
the whole
Really.
house. Yeah.
Mhm.
Mhm. And then that's the thing. It was like it wasn't designed for women in mind to be in the workplace. So when things became just so expensive and just impossible to live off of one, like a single income household, you can't really. So like women had to go out and like nothing was put in place to accommodate that change,
Right. Yeah.
Mhm.
Mm-hmm.
I think there's societal pressure as well, because I think often for us, it's or for women, a lot of women, it's reframed as resilience or strength. You're supposed to
Mm-hmm.
power through your
Mhm.
pain, and you're so strong, you're so brave, and you, I mean, it's offered as like a badge of honor, but really, it's not.
Mm-hmm.
It's like that's not resilience. That's fear. We're doing it because we fear
Mm-hmm.
repercussions at work. If I need to take a day off because I'm burnt out or I'm in pain, I'm uncomfortable, then I might be looked at as not a good worker. I might miss out on a promotion. I might,
Mm-hmm. Mm-hmm.
not be seen as not reliable. And that's just, I think that's a problem that's not just addressed by policy, because you could have the policies in place, but still have the fear and stigma is stronger than uh, than what am I trying to say? Yeah, the fear is
It's
yeah.
yeah, it's got to be like a cultural shift in
Yes.
order for people to actually like
Thank
use
you.
them.
Yeah.
Yeah. Yeah.
Mm-hmm.
Right. That's one of the things that was found in Spain. So they do have the menstrual leave, but they did a study the year after the menstrual leave policies were implemented, and they found that like very little women actually took it.
Yeah,
So
I
like
did read that as well.
only
Yeah.
like 2 in like 10,000 women took it, because the barriers to that was that you had to have medical documentation. And so that already is a barrier, because you have to disclose something like that, something very private
Yeah.
to
Yeah.
your
Yeah.
employer. Like,
Mhm.
okay, I have this medical, but you might not feel comfortable.
And
And
I
then,
know most CEOs, etc., are male.
Yeah.
yeah,
Like,
exactly. It's like,
yeah.
I don't want to disclose that. And,
Mhm.
or,
Mhm.
or I have to go through how many appointments to get officially diagnosed and, to
Right.
seek that. And then the other thing is, again, the fear, the stigma of being, perceived as less than.
Weak.
And so, yeah.
Yeah,
And,
you need a day off.
or being discriminated against
Mhm.
for,
Mhm.
maybe advancements in your career. So even though
Right.
so they don't take, even though it's there, it's within their right and legally within their right to take it, they're still not taking it. So it's,
and that's just a whole other commentary, right? On like the societal pressure.
That's why, ladies, we have to talk about it.
yeah, exactly.
And also like the social media pressure, I feel also to just be perfect, right? And do all the things, and all the women who own businesses and show like them taking care of their kids and like balancing everything perfectly with a smile on their face. And like the reality is like that is not what's happening. Like the majority of women are like, we're struggling. I feel, there's just too much pressure to do it all. And, like I said, the way the world has evolved and the workplace has evolved, like the policies haven't evolved with it. Like if we're going to be in it, we just have biological realities. Like we have different things going on and we need to be accommodated for. Like I can say that I was pregnant and working and, I was pregnant during COVID and it was just a really hard time. And I feel like there weren't like, accommodations made for pregnant women. You were just expected, we have a very physical job. So still expected to like do everything. And that was really hard. And then I just happened to have my little one on October 2nd of 2020. And like October 1st of 2020 was when like family leave in the federal system was allowed for the first time. So I got it by a day and like, so we can have 3 months off, which is crazy that like, this is not just something, and like 3 months isn't enough really. I ended up taking more of my own time, but like, we need to have way more time than that. Like your body still feels like it's pregnant. Your mind is going through this huge hormonal storm. Like you're not yourself. Like I had like pretty bad postpartum depression. Like you need more time to adjust and to have like a 3-month-old and you're still like recovering in every way. And like to just go back to work and be like, here, you've been gone for 3 months, like you get back into it. You better start picking up the slack because, we've had to manage without you. You almost feel bad about it, and women go back way before they should, I feel. And there's just no like,
It's wild because like the United States is one of the only like developed nations to not have a federally mandated parental leave policy. It largely depends on, it's a state level or what your employer is willing to give you. I was shocked to find out so many states it's not required. So they leave it to the employer or to the state.
So it could just be you're either working without pay or you're taking like all your sick leave and your annual leave, right? Or like, but it's still, no matter what it is or whatever they give you, it's not enough, you know, and whatever you take is not enough. Or like you're working without pay, that's such a punishment, like if you're taking care of a newborn and probably another kid and a partner and a house, you're still doing all the things and it's just, and then you're expected to just go back to work. And I feel like women are really suffering and there's just not enough accommodations made for it.
Yeah, there needs to be catch up. I mean, New York last year implemented I think it's like 20 days. What was it?
The 20 hours of the prenatal?
20 hours of prenatal. That was only implemented a year ago. This is about a year ago. It's New York, though. I don't know about any other state that you can have 20 hours of prenatal like leave to take care of healthcare issues surrounding to take care of appointments surrounding your pregnancy.
So that goes for fertility treatments and also for end of pregnancy. And so I was working per diem when I had my miscarriage. And without that, I wouldn't have gotten paid for the shifts that I needed to take off for my D&C and things. So thankfully, like the policy there. And even so, my supervisor still texted me and was just like, so you want me to cancel all your patients and pay you for it? ? So
was he a man? Of course. Of course he was.
And I was like, yes, that's exactly what the law says, and that's what's going to happen.
Right,
but like, that's the response. Like,
and the answer is yes.
The answer is yes. I just thumbs up the text. I was like, I'm not even dignifying this with the response. Talk about sensitivity, right?
But that sensitivity even affects, I think, females in power as well. Even like it's not automatic that a female is going to be sympathetic because the generations before us, because they also had to work and go through life without any of these protections. They often then are like, well, I had to do it, so you have to do it. So you may even have a female supervisor or higher up, and they will just be like, what? Like they won't be like empathetic or sympathetic to your needs as well.
I have a female boss too that has like a chronic disability. So she has chronic pain. And I think because of that, like anything that we experience. It's just, she knows that she's like got it worse. She's like, I show up like
Ugh.
zero sympathy,
Yeah.
but it doesn't help.
It
You know, it doesn't help.
It goes really deep.
Doesn't help.
Yeah.
It goes,
It's super
yeah,
deep.
like the cultural shift that needs to happen. I mean, yes, there needs to be like policy shift. There needs to be,
Like cultural awareness, just something to combat the bias and more conversations around it in order to have that cultural shift. So,
Yeah, for sure. I can also say for myself that I did fertility treatments for years. And like, I didn't want to tell people, I didn't want to tell my boss, and I didn't want to tell my coworkers at the time. And I was doing it on my own. So like fertility stuff is very demanding, and it's all very time dependent to like the minute sometimes, when you have to take things, when you have to get tested for things, when you have to like, go through procedures, it's all timed with your cycle. And, I even telling my boss, like I couldn't get any kind of like accommodation or sympathy. Like for one of the procedures, I needed a uterine biopsy, which like you have to go in, it can be like heavy cramping and bleeding after. And I told him like, I can't come to work. And he's like, well, why not? You should come in the afternoon after you get it done. A man, of course, telling me that. And like, that's crazy, like to not get any, like, it's literally a procedure that I'm doing like in the office, and like to not getting any accommodation. But it's so hard to like time, fertility treatments and then accommodate for that at work. And they wouldn't, I didn't want to tell anybody, but even when I did, they wouldn't like accommodate me and like help me, so it's still frustrating. And I feel like, policies need to change, it's just really upsetting for like women who are going through these processes.
Well, now that would be protected with the 20 hours of the prenatal like appointments. That counts for the fertility stuff too. So that would have been like, exactly, yes, cancel my patients and still maybe, and you cannot retaliate. And that's how that's happening. Yeah.
But it's wild that was only implemented a year ago
Right.
and in New York. So it's not
across.
That's crazy. So that's crazy. And then there's other things like, I don't know if where you're at like perimenopause or in that stage or not, but like when and we talked about it in another episode, but like there's so many symptoms that happen like perimenopause, and like you're fluctuating in hormones and stuff. And like, one thing people may not realize is like you lose clarity, you lose focus, right? And like you can forget words, and your word recall can be bad. Your maybe like it can affect your productivity because you just keep losing track of like what you're doing, where you put things. And, this is all literally from, hormonally what's happening medically in your body. And, obviously these things are just now coming to light. People didn't even really study menopause and perimenopause until very recently. So I feel like even having, any kind of accommodation for this, like there's still like these high expectations for like work, and, these things are happening where like women are having intense hot flashes, and women are having trouble like with just immediate intense joint pain. Like you could just have like joint pain all of a sudden, and they can just kind of be not gradual, and you have to get through your day. And like I said, we're very physical with our job. So like we could be lifting patients, we could be, running around between 5 patients at the same time, and you're just expected to perform, like you did before. And that's like really hard. And then how do you bring that up too? It's like, it's not something you can show, like a test result for or something and be like, I need accommodation.
And they're so hesitant to like, at least in my experience, like call you in perimenopause. Like you need, again, like how many doctor's appointments, you need like so many lab tests to like that are abnormal to kind of like prove that. So even if you're feeling like, I was having like a lot of like hot sweats, and they're still just calling it like perimenopausal symptoms, like and stuff like that. But like having like hot sweats disrupting your sleep. And so I pushed my shift. I was lucky enough that my work accommodated like a later shift, because I was, until I kind of figured out how to stabilize like my own hormonal issues. But they were like flexible with me at least, which helped like a ton. Because I agree, like when you don't sleep, and you have those the brain fog like moments, like, and you're taking care of like patients, like that's like not really the greatest, safest situation like for anybody involved. Like like patient safety wise, like
when you want me on point, when like I'm at my best, like, I'm telling you, I'm not at my best right now. You know?
Can we like just move it? Can I come in at this point? And thankfully, like I didn't have to like, go into like why or anything. Just kind of, they were able to like work with me on stuff. But yeah, like I could see how that's like such a challenge. Yeah.
Yeah. And
And yeah, no, I'm just saying like the menopausal, like, so, like, I don't think that there is any, because I was just curious, like for myself and I was very young. So I didn't even know really what was happening to me, because my mother like had a hysterectomy. My grandmother had a hysterectomy. Like just nobody went through menopause per se in my family. So I had no idea. Like I was like, what is this? Like I thought I had cancer. Like, and I was young. Like I was like raised in a hot sweats, like a thing with cancer too. Like I was like, I must be dying. And I was like younger for like starting this type of stuff, like on the younger scale of things. So, and it happened like when I went off birth control trying to conceive. So I didn't know if this was like my normal. And yeah, just with all of it. So I was like, wait, so like what is there like for this? And like how you said, the research on it alone is like, there's not a lot. And then as far as like, yes, there's like menstrual leave, but menopausal leave seems to be like, there's no, like, is there places that are doing like having menopausal support? I really didn't find like we have a
I don't think
library.
so.
Yeah,
I don't think so.
there's not like menopausal like policies, like they menstrual, but like, that's
And,
like
look
really
at
behind.
all of these stages that women go through that like, it affects so much. And I feel like there's just not accommodations at all. That's crazy. And you're right about the insomnia. That's a huge part. Like you could just wake up in the middle of the night and feel like it's the middle of the day. And then you have to be productive the next day, and it's just all of these hormonal changes.
And oftentimes, like menopausal women, they're usually at that point in their lives, they might be in very senior roles in their career.
Yeah.
So they could be higher up and have a lot of expectations on them, and they power through and feel at that level in their career that they're not able to. So, and like you said, you're still trying to figure out, what am I feeling? I don't know what this is. I have to go to so many doctor's appointments to get diagnosed. Am I in this? And while you're figuring that out and in all that pain and discomfort, how do you explain that to your employer, right? So, or to where you work for, or to your team, like that.
And it could just be attributed to so many different things, right? So they could just be like, oh, whatever. Like you're just watching Netflix late at night or something, and like you're not getting sleep.
I just ate something bad.
Yeah.
Like it's very easy to dismiss.
Dismiss for sure. What do you ladies feel about like men don't have the same pressure as women to like advance their careers, and like they don't have to worry about the interruptions, Like I feel like when I was at work, there was this leadership development program that I did like 2019, and I knew I was doing fertility treatments, and I had actually said it to a coworker. I was like, oh, I'm not going to do it. I shouldn't apply for this year because I'm going to do fertility treatments and I might be pregnant. And she said one thing to me. She was like, a man would never say what you just said, right? She's like, do it, apply, don't let anything stop you. And I did it, and I was pregnant, and I was like, like running back and forth to appointments. And I learned so much in that program, and I'm so glad I did it. And I thought about that so much after, like a man wouldn't ever have that thought, like, let me not do something for my career. And build leadership skills and do whatever and try not to, because I'm going to maybe be pregnant, and like men just don't have that like thought process that they have to have, right? And I'm also like a single mom by choice, so like I had to think about myself, like I can't rely on anyone else. So like, what do I do? So it's just like men just don't have those considerations that they have to take.
And growing up with like, so I'm the eldest, and I have 5 younger brothers. Yeah, no, they don't. I feel like we were treated like fairly equally, and like a lot of the conversations that we had were like around career and stuff were similar, and like we were all like really motivated. But that was like always the one thing, like, oh, like I felt like I had to choose between a career and becoming a mother. And that was like always like a trade-off. And my siblings did not even cross their mind that they would ever have to choose between parenthood and like their job progression, like not even a beat, like to try to help, like not like, of course not, like not even at all.
I mean, I guess they may not feel like a biological pressure too. So like women who maybe want to have families also.
Timelines,
They're just, they're on a timeline. They're on a, but men don't really have that. It doesn't mean that they don't care about family, but I don't think that they experience the same rush or pressures or even fears of, like, oh, my career is going to suffer for this or that. So it's, they don't have that.
So what can we tell women to do? What can they do for themselves? We can say advocating for flexible schedules, maybe finding out about these policies. Like I didn't know about this perinatal. You said it was in New York.
Prenatal.
New York,
Yeah,
prenatal.
yeah.
Mhm.
Prenatal leave.
And very recently, you said.
2025, I think like
Oh,
January,
okay.
January or
Yeah.
February
You
2025
get
was
20
implemented.
hours per year.
Mhm.
So it starts from like the time that you first take it
Mhm.
till like that's the 1 year.
Mm-hmm.
And
Well,
then,
that's brilliant. And is it like, per year? So like if you had another kid, like
yeah,
another year, you
then
could do it again.
Yeah.
Mhm.
That's brilliant because I took so much time off for like doctor's appointments, OB appointments, tests, and stuff like that. So that's brilliant. Obviously taking sick days. We don't have menstrual leave days. You take sick leave for mental health days or menstrual leave days if you need. I think that's really, really, really important to rest and repair and recover. Prioritizing sleep and recovery. I feel like that is just so important. I've been getting a lot more sleep lately. I feel like I can kick things a lot sooner when I pick up like, viruses and whatever. I feel like I am just like healthier at baseline. Just talking to administration at your job to see like what maybe there's like all these policies that you don't even know that your job has, that like you don't know about it until you ask.
Right,
Yeah.
Mhm.
So we have to like stick together and trying to, fight for
It would definitely benefit from more advocacy, more discussions just to erase a lot of biases because it could very well lead to more productivity in the workplace as well if you can have accommodations, even if it's not days off, but like let's say something like remote work, like
Yeah,
allowing
amen.
remote, you might be more comfortable and be very more productive if you were allowed to, hey, this is time that I need to work remotely where I don't
Yeah.
have to worry about my appearance or
Yeah.
that I'm
Commuting
sweating or anything, but I could still crank out my work or I can
Yeah.
log in a little bit later and get to
Take a nap during my lunch
yeah,
break.
exactly. And
Lay down
it may just
off
make
that.
you more productive, like if you had some, support surrounding accommodations at work. So.
For sure. Is there anything you ladies would like to add?
I think just keep the conversation going, know what you're entitled to. Yeah. And hopefully, they find like there was a study with McKinsey that like the 25, like the top quartile for like diversity as far as gender diversity in the workplaces, the companies that had more like female and were like in that, like they perform better.
Yeah.
So like we do like not only like is it a reality that women are in the workworkplace, like it helps. Like
Yeah.
it shows that like we do good in the workplace. Just yeah. So like we're not like weak or like unproductive. So I just say like keep talking about it. Encourage your female friends to take those days if they need it. Like let's break that culture of like pushing through the pain.
Yeah.
Let's support each other with that. Like I think solidarity with that, especially if you are in a leadership position or if you have access to like advocate for policies that are within that. And I think that's the biggest thing I would say. Just keep talking about it.
Yeah.
And support each other.
Yeah.
Amen. I like it. Well, thank you, ladies, so much for joining me today to discuss this. It was a great conversation. Thank you for all your input.
Thanks for having us.
Yes,
Yeah,
of
thank
course.
you. This is fun.
Thanks. Well, thank you for joining us today for this very important conversation. I hope you learned a lot, and I hope you join next week for the next episode of Ladies, Let's Talk About It.